Mr. Speaker, the importance of ensuring that there are sufficient numbers of spaces in units in our personal care homes specializing in addressing aggressive behaviors that can develop in some patients with dementia and Alzheimer's disease is something that has been known for years. Today, we have 1,251 patients waiting in hospitals across the province for the appropriate specialized care for seniors who need it, and a proportion of these need these specialized places. Can the Premier tell us the number of spaces for patients with dementia and aggressive tendencies in such units in personal care homes which are today fully operational?
I thank the member opposite for the question, Mr. Speaker. The Winnipeg Regional Health Authority has been working with their partners in the community, including Action Marguerite, to put in units that are special to deal with the complex needs of persons with things like dementia, with Alzheimer's. Some of those individuals have some additional risks attached to potential behaviors they could express while being in those facilities. So a number of additional units have been put in place. It is a serious problem. The WRHA, in partnership with their local partners and the Department of Health, are working forward on doing this. As the member knows, we're building over about $200 million worth of additional personal care homes in Manitoba, Mr. Speaker. And I have to say that the opposition has said that they will be doing $500 million of cuts. That won't build one more personal care home bed. The Liberal Party of Manitoba, with their health and education levy being eliminated, $471 million not available for building personal care homes, Mr. Speaker. So I'm glad the former leader of the Liberal Party, the member for River Heights, cares about this issue. I only ask that he goes to the leader of the Liberal Party and cancel that reduction of $471 million, which would help build more personal care home beds in Manitoba.
Mr. Speaker, the Premier has made an announcement, but his foot dragging has produced few such units which are actually operational to date. Many Manitobans want to stay in their homes as long as possible. It's vital that all those who are involved in providing home care receive education related to the care and support of individuals with dementia, so that people with dementia can remain in their homes longer. Why is the Premier not fully supporting enhanced education for home care workers in the care of those with dementia, and instead is leaving more than 1,200 patients waiting in hospitals for the non-existent personal care home beds?
And again, Mr. Speaker, we think it is an important issue, which is why we've put additional resources both in the community. Our home care program has special features to it now that allow for people with more complex needs to be looked after in their homes. The caregivers tax credit has been expanded, Mr. Speaker, to allow for more support for people that look after people with complex needs in the community, including married couples where one's looking after another, and we find that they're doing a phenomenal job and they need some recognition for that, Mr. Speaker. But I have to say again, the intentions of the Liberal Party to eliminate the health and education levy means $471 million less each year. That's nearly $2 billion over the next mandate that would not be available to build personal care homes or to look after anybody with complex needs and behavioral risks. The Leader of the Opposition is also planning $500 million worth of cuts, Mr. Speaker. That won't build any personal care homes. He can't even commit to the senior school tax rebate today when he was speaking to the Winnipeg Free Press. He can't even commit to a little bit of support to help seniors maintain their cost of living in the community, Mr. Speaker.
Mr. Speaker, dementia care education may be continuing in personal care homes, but it is the Alzheimer's Society of Manitoba, not this NDP government, that is working on its own to educate home care providers in the same manner. Manitoba Liberals have committed to modernize home care and enhancing such education to make it more effective in Manitoba. Why is the Premier not fully supporting the important initiative of the Alzheimer's Framework to improve education and training of home care workers in relation to the care and help for those with dementia?
Speaker, we have in fact developed a program called Personal, Intellectual, Emotional Capabilities, Environment and Social Training for staff that look after individuals with complex needs. And this is a serious problem. We do have people living longer in our society. We do have people contracting Alzheimer's and dementia. There's lots of excellent research going on in that to be able to identify how that disease can be mitigated or prevented. But for those that have it, we have an obligation as a society to look after them. And cutting $471 million out of the health and education levy will not look after one of those senior citizens. Cutting $500 million out of the budget, like the Leader of the Opposition would want to do, will not look after one of those seniors, Mr. Speaker. They cannot stand up and say they care for seniors while they're cutting the fundamental resources that those people need to be looked after. Shame on the Conservatives. Shame on the Liberals, Mr. Speaker.